Today marks the 3 weeks since we left for spring break and 18 days since LISD announced we are moving to online school.
That's right, Evan. And since then, many of us, hopefully, have been practicing social distancing. I know I have. And a lot of us have been staying at home, but we may not realize why it's so important. Claire Mallet has more.
Last week, President Trump made an announcement.
Therefore, we will be extending our guidelines to April 30th.
In the past week, the U.S. has surpassed every other country in number of cases. Less than a month ago, COVID-19 was characterized as a pandemic. In order to slow the spread of the virus, governments around the world have advised and enacted the practice of social distancing. Many of us have heard the phrase,
flattening the curve.
Flattening the curve.
But we may not know just why it's so important. Dr. John LaPook helps to explain the phenomenon.
Early on in an epidemic, you see a spike in cases. You see it here in yellow. And when that happens, a healthcare system can get totally overwhelmed. Not enough health professionals, not enough hospital beds, not enough medical equipment. But if you can somehow do something to flatten that curve, to just delay it, you see it here in purple, then maybe the system won't get that huge pressure on it and it won't crack. Then there's this social distancing. That basically just means staying away from each other. Is there evidence that it works? Absolutely. In places like China, South Korea, we're seeing it work. But in order for it to work, we have to all do it together, we have to all do it everywhere, and we have to do it right now.
The tricky part about the virus is that even if you don't feel sick or show symptoms, there's still a possibility you have the disease, and interacting with others, though it may seem harmless since you don't believe you're sick, can accelerate the spread of corona. It's a domino effect, and that's why it's important we stay inside. A lot of people have been comparing COVID-19 with the seasonal flu, but there are some pretty important differences between them. While the regular flu causes more deaths and affects more people, scientists have been able to monitor and study the flu for decades, therefore making it more predictable and enabling doctors to know approximately what to expect for a season, unlike corona. Dr. Fauci, director of the National Institute of Allergy and Infectious Diseases, spoke with Trevor Noah about the disease and how COVID-19 compares with the seasonal flu we all know.
The other part about it that's really so different from anything that we've ever faced before is that if you look at the mortality of seasonal flu, the thing that you and I go through every season, the mortality is about 0.1%. That's a lot. And we get used to that morbidity and mortality. But the mortality of this is about 10 times that. It's at least 1%. So it's a disease that not only is easily spread, but it can be devastating, particularly for a certain subset of the population. Demographically different. The elderly, those with underlying conditions, heart disease, lung disease, diabetes. It can be very serious.
Most importantly, COVID-19, unlike the flu, doesn't have a vaccine. So in order to protect yourself and others from getting it, the best course of action is to avoid large social gatherings, be sure to wash your hands often, to stay inside, and social distance. The main issue with COVID-19 and how quickly it's spreading is hospital capacity. Hospitals already have patients with unrelated issues, like injuries or surgeries, for example, and pre-existing virus patients. The problem we face is if COVID-19 keeps spreading, hospitals not only will be overwhelmed, but have been overwhelmed, and won't be able to properly take care of those who are sick, which is what happened in South Korea, Iran, and Italy, whose hospitals were some of the hardest hit. Treatments won't be as effective, and there will be a lot of unnecessary and avoidable deaths. That's why it's crucial we practice social distancing.
Estimating the virus could kill between 100 and 240,000 people.
If you do feel sick, Dr. Fauci has some advice.
People who are sick should stay home. You don't go to an emergency room, you don't go to a clinic, you get on the phone and you ask for advice and instructions from your physician. Then you use those instructions to determine what you're going to do. But the first reflex should not be, I feel sick, I'm going to go to an emergency room. I feel sick, I'm going to just go to a doctor's office.
So please, stay inside and only leave for necessary purposes like grocery shopping. Because while it may sound cliched and over-dramatized, lives depend on it.
Thank you for that report, Claire. I know that having to stay home so much has been a little hard for me.
Yeah, me too, Evan. But it's good to be reminded that staying home can really make a difference.
Hey there, Evan Vines here. If you liked what you saw, make sure to hit that like button. And if you enjoy all things CPHS, hit subscribe. Have a great day or not, the choice is yours.